Good morning, everybody, and welcome to today's session. My name is Megan Butler, and I'm a part of the Liftoff PGH team. We are thrilled this morning to be joined by Kids Plus Pediatrics for what is sure to be a really fun and exciting session. So thank you for everybody for joining. Kids Plus Pediatrics will be giving a virtual tour of one of their practice locations led by CEO Dr. Todd Wolynn, with cinematography by their communications director, Chad Herman. To give you a little bit more information about Kids Plus Pediatrics is Pittsburgh's most caring, connected, comprehensive medical practice. They are proudly independent and physician-owned with 22 providers across 3 offices. And Kids Plus has spent the past decade reimagining the pediatric practice both physically and virtually. So we're really excited to get a special virtual walking tour of one of their practice locations today. Just so everybody is aware, we will have time at the end for an interactive Q&A with the Kids Plus team. So if you have questions that come up as we go through this virtual tour, please feel free to type them either in the chat or in the Q&A panel. And we will be sure to address those all at the end of the session today. So with that, I'm going to hand it over to the Kids Plus team, who will take it from here.
Hello, well, I see you've got the golden ticket. So let me take you on a tour. Now, due to the pandemic, it's academic that alas, I must wear a mask. And while my lips may not move, just follow my groove. Come with me and you'll see pediatrics reimagination. So, welcome into our space here. We're at our Pleasant Hills office. And if you'd like to make a donation to the Community Food Bank of Greater Pittsburgh, we would appreciate it. Come on in. This is our reception area, and you can see we are collecting toys with Play It Forward Pittsburgh. And this is our lovely Kids Plus staff. We have no Oompa Loompas, but we do have amazing people. So follow me into the clinical area. So Kids Plus is an independent pediatric practice. We have 3 offices. We have close to 100 employees and about 20 providers. We are all known and our amazing providers and team that we have here at Kids Plus. This is a typical room. Note, very colorful, but not primary colors because we see patients up till their 22nd birthday. So we like to have an inviting space that's colorful and fun for all. Now, I'm going to take you through a tour through the 18 rooms that we see here in our clinical area. This is where we have our concussion testing, the same concussion testing that players in the NHL, NFL, and the ballet get. More colorful rooms here at Kids Plus, and a very long hallway down to complete our 18 rooms. Now, at Kids Plus, we do more than just general pediatrics, and that's part of what I'm going to show you today, partially on our tour and partially on a slide presentation. So keep walking with me. Oh, one more look into our beautiful clinical area. And don't forget vaccines, right? So come with me and you'll see a world of vaccinations. Safe and effective. Actually, we should all get them, including our flu vaccines, which we give readily. I think we gave about 7,000 or 8,000 doses already this time. We're going to head back out to the clinical reception area. Now, there's some interesting things I want to show you here because this is where things become a bit different. You might say general pediatrics, isn't that just where you get your sick and well care? Well, no, not at Kids Plus Pediatrics. So let me take you into our Breastfeeding Center of Pittsburgh. Now, in the Breastfeeding Center, which is normal, physiologic, and part of best practices, we have a special center to help people from throughout the Western Pennsylvania region and actually the tri-state region. Let me take you into a typical breastfeeding center room. So, and I'll stand next to our lovely reclining chair, which allows moms to breastfeed in a variety of different positions. As you can see, the color scheme's a little bit different here, but we provide the best of care. And note that all of our providers are either lactation consultants or are training to become lactation consultants. And before we leave, I'll show you something that we have in the closet, which is some of our other programmatic work that we do here, such as our Greater Pittsburgh, Food Bank of Greater Pittsburgh 20-pound non-perishable food boxes that we give to families who qualify due to food insecurity, as well as diapers, which we collect and hand out to families in need, typically using Medicaid as a proxy for need. We have one more thing to show you, actually a couple more, but follow me. Now we're back out into the reception area, and we're going to go back out into the vestibule. So at each of our Kids Plus practices, we happen to have this lovely space, and it's called the well. Now the well connotes wellness, as well as a place to gather around. It's a community engagement space. Let's take a look at it. Follow me. Now, this is a multi-purpose room. It can be set up for classes. It can be set up for imagination playground. It can be set up for peer-to-peer facilitative moms groups, like our New Moms Coffee groups. Each well at Kids Plus in each of our 3 locations has a general multi-use area with chairs and a variety of things, including imagination playground that can be set up. And this imagination playground has been shown to have amazing developmental impact on kids regarding socialization and team building. Each well has a kitchenette because they're kind of self-contained spaces that can be open while the rest of the practice is closed. Why is that important? Believe it or not, kids actually have birthday parties here. Moms have showers here. It's all about building community trust and community engagement. We even have bathrooms so that both spaces, or all of our spaces for our wells, actually have a nice pleasant area to go to the bathroom, to have food preparation, and to have community engagement. Follow me. Because now we will take you over to one of our providers. Oh, yes. Actually, follow me this way. I want to take you down here first is to show you that the space is actually not just important for our patients and our families, but also for our staff. This is our lunchroom area. And we're quite proud because we know that in a lot of healthcare spaces, lunchrooms are often an app. Our families that include our families that are employees here, to have natural light, to have a pleasant place to sit and eat. And of course, during this pandemic, people are eating at their own tables, and we have an additional space where they can still sit out, spread out more than 6 feet at their own tables. This is our nerve center for our triage and clinical care coordinators. Follow me through here. Now we have to keep quiet because they are on the phones, but we are going to walk through and see that we can seat up to 10 people, but during pandemic times, we are a little more spaced out again. And I'm going to take you back into our clinical area to prepare you for a few slides to see. Now we're going to walk through the front administrative office because not only do we have spectacular nurses and medical assistants and breastfeeding center and billers, but we have an outstanding front office team too. And that's true at all 3 of our Kids Plus practices. So follow me to the administrative side of Kids Plus, where we check you in to the front, check you out over here to the sides, and take you to our conference room. And each of our Kids Plus offices has a conference room because we use that space to plan and to make sure we are taking things to the next level in almost a continuous fashion. Follow me in to the conference room. Okay, so here we are in the Kids Plus conference room, and I, Dr. Todd Wolynn, along with our cinematographer, Chad Herman, communications director, I'm going to switch over to a screen sharing mode and take you to a little bit of a slide presentation that I hope you'll find interesting. All right. Unmute. Okay. Now, the Kids Plus Pediatrics is typically confused with general pediatrics in terms of people often think of general pediatrics of things like this, right? Happy, fun, kind of easy, happy-go-lucky things. But at Kids Plus, we think of pediatrics in quite a different way. Actually, we think of it this way and do pediatrics this way. What does that mean? Well, we're built like this. Think like this and perform like that. Now, when I say built, we're adaptable. We are absolutely tenacious in the way we approach things. We are, of course, medicine focused, but also business focused. And when I tell people,
Dr. Wolynn, I think we lost your audio. Chad, I think you may need to get closer to Dr.
Sit at the desk with my laptop or someplace else is better for me to go, like one of the provider spaces.
I mean, that should be okay. I'm not sitting in there, so.
I'll go find one of the provider
You can
spaces.
sit in there.
Chad, can you hear me?
I'll find one.
I'm not sure what other spaces might be open.
I'll find the provider.
Yeah, it's all clean.
You good? Okay.
It's all clean in there. I'm just not sitting in there.
I just don't want to like take all
being
this.
available.
So yeah, it's only going to be like a half an hour. So.
Dr. Wolynn, we're going to need you to unmute your mic on your computer. I think that you were still picking up on the audio from Chad's computer.
I was. Can you guys hear me now?
Yes, we could hear the very first portion of the conversation.
Okay, gotcha. I'll go through it. Thanks again.
On that.
Okay, so I'll go through right now. Again, thank you and welcome to Kids Plus. And again, when people think about pediatrics, we say they think about this, but this is exactly how we do pediatrics at Kids Plus. Built like this, thinking like this, and performing like that. And what that means basically is we are built to be adaptable. We are definitely medicine focused, but we're business focused as well. And our performance, we think of ourselves as a living lab. If we can think up something that'll help our families, our patients, and our community, and as long as our CFO says it won't break the bank, we're allowed to try it. This is a lot of the things that we're known for in Kids Plus. And as you can see, it's well beyond typical general pediatrics. And again, we're an independent pediatrics, not owned by a large entity, but doing this work on our own. Now, in one slide, if I can tell you the difference for traditional pediatrics, this is it. Most people think of pediatrics and most pediatricians think of pediatric practice as a place where they provide well care, seeing kids for their immunizations, measurements, forms, or they see them with symptoms and have to decide, do I need to give them an antibiotic or not? And I tell people all the time that if this is all you think pediatrics is, and if this is all you do, then you really are squandering the immense abilities of the pediatric practice. And I know in Liftoff 2020, we're talking about the practices of the future, both in physical space, but also in virtual spaces too. And so I want to take you through how we view pediatrics. Our mission statement is to meet people where they're at, whether that's a family with a single parent family or a child with special needs, to learn about who they are and to grow with them. That's our favorite part of pediatrics. The practice was started by two gentlemen up there in the left in 1972, but the next 6 people to join were all residents under them. And so we have a very unique kind of family feel to the practice. Half of our providers are physicians, with the other half being nurse practitioners, physician assistants, as well as a licensed clinical social worker, 2 licensed clinical social workers, and providing a range of services. We also are a teaching practice ever since our creation in 1972, and currently teach medical students from LECOM and Drexel, as well as Children's Hospital residents, physician assistant students from Slippery Rock, and health policy and management students from the Hines College at CMU, and help people become lactation consultants. Now, in traditional practices, most of the focus has always gone here to the child, but at Kids Plus, we really focus on providing a multitude of services for both the mother and child. And now we do have mom families and dad families, but typically we have the vast majority of our families are mom-dad families, and the moms, regardless, do the heaviest lifting, even if they too have a job. And that has, unfortunately, the way social supports, the moms do bear far and away the brunt of a lot of the child rearing on their own, and we try and provide immense value to them, but we also have significant services for the entire family. Now, in today's day and age, you make money despite hearing all that you hear about, oh, we pay for quality, which is in fact not entirely the case, because you can jump through every hoop, which, by the way, Kids Plus Pediatrics is part of a clinically integrated network. This means we are tied with all the pediatric providers, those owned by UPMC, those owned by AHN, a couple other independent practices. And when our quality and our cost are compared, we are at the top tier in terms of quality. We are in the lowest tier in terms of cost. But these things you see on this slide represent real time sinks that many practices nationally just choose that they don't have the time to address these things because they take up too much time and therefore reduce the volume of patients that can be seen. Now, I said that there are quality incentives, and Kids Plus meets all those quality incentives, but I can tell you from comparative work that we do, including work that we do with the American Academy of Pediatrics, it's much easier to make 2 to 3 times the money by just seeing lots of patients and not doing the deep dive into these types of areas. But at Kids Plus, we've made the decision to dive into each of these areas. And so it takes more time, but it is exactly what parents need and want to see and want to hear at their pediatric visits. How do I get my kid to eat vegetables? How do I get my kid to sleep through the night? How do I handle getting to a visit when transportation is not available to me? How do I handle discipline or learning about development? Now, Kids Plus has 3 offices. We are currently in the southern office in Pleasant Hills. It's been around in this general area for about 40 years, in Squirrel Hill for about 17 years, and up in the Cranberry area, Mars area, for about 7 years. And we're a level 3 NCQA patient-centered medical home. We were the first pediatric practice in the region to be so, and we're less than a 20-minute drive from about 75% of the population. At Kids Plus, we have various components. Almost like a tech or manufacturing company, we have a pipeline thinking upstream, what do we need to bring to market next? Things coming out of the pipeline are much more well established, while things further up the pipeline are still being further built upon and further improved. When I show this slide, this is the layout of our 3 offices. And what I explain to people is that this is kind of like Costco meets Starbucks. And what do I mean by that? Costco, everything you could want from your pediatrician or parenting resource under one roof, meets Starbucks. That quality of your double pump mocha latte should be the same in Seattle as it is in Dallas, as it is in Philadelphia. So at Kids Plus, our breastfeeding care is equally good at every office. Our concussion care is equally good. Our mental health care is equally good. Now, we will beta test and try new services out at a singular office, but once we've worked out the kinks, then we immediately take it out to all 3 offices. And as you can see, the blue areas, the general pediatric areas in each of our offices. Our purple area is the breastfeeding center, that community engagement space, the well, you can see it in each office. And then we have some multi-use space as well. Now, most people again think of general pediatrics and say sick and well care, but as you've seen, we provide a range of additional services and are known very, very well for all of this work. Now, the physical immersion you saw, it's a colorful office. It's modern, but it's not 2 primary care colors or two primary color because we want to be welcoming to our adolescent and young adult patients. And this same finishes are carried out throughout all 3 of our offices. Now, the breastfeeding center, you got to see an example of one of the rooms. The breastfeeding center is led in the bottom left by Dr. Amy Madalena, who's a pediatrician, but also a lactation consultant. And again, this is the color scheme and the general layout of our breastfeeding center rooms. Now, what's important to know at any one time, we usually have ballpark of around 18 to 20 lactation consultants. This is quite unique. As you can see, several of our physicians, physician assistants, and nurse practitioners are also lactation consultants. I will tell you, a hospital like McGee Hospital with about 10 to 11,000 deliveries has about 7 or 8 lactation consultants working on lactation. And here at Kids Plus, again, close to 18 to 20. So we're very proud of that. The wells, you saw the well in the bottom right, that's the one in Pleasant Hills, but we have them in each of our 3 offices. The bottom left was the very first well that we beta tested. That one's about only 800 square feet. That's actually a special event for families to come and to enjoy a night out, actually without the kids. The only cost of admission was a dessert. So that's about 800 square feet. To the top right, that's about 2,000 square feet. That's in Cranberry. It's quite a large space. We know that's a fast growing office and wanted to make sure it was built out with ample space. And at Pleasant Hills, that's about 1,500 square feet. So we were thrilled to be able to have these spaces again that can do classes, can do mom-to-mom peer facilitated meetings, can do birthday parties, can do a variety of other types of gatherings. It really is something that makes, I think, Kids Plus incredibly impactful in the way we can engage our community. Several of the classes and the meetings are open to the entire community so that we work very hard to make sure that we're quite inclusive. Additionally, several of the offerings that we have are for free because we know that some people can't afford even low-cost classes. And so we've worked hard to make sure that there's not a barrier there in terms of cost for many of the things that we offer. That still doesn't address all the social determinants of health because we know that some families still don't have the ability to take transportation to an office easily or can't afford childcare for children that might not be able to come to that meeting, for instance, if it's just a new mom's coffee meeting with just moms and infants. So there's still plenty of challenges, but at Kids Plus, we've worked to break down as many of those barriers as we can, and we're continuing to work to do so. Now, we have a Kids Plus educational branch. These educational classes many times are offered in the well, but of course, due to the pandemic, we have easily shifted multiple offerings over into a virtual setting, oftentimes using Zoom. The spine of the classes that you see there are called the New Mom's Coffee series. What is New Mom's Coffee? It's actually a class for moms, or it's a mom-to-mom peer facilitated meeting for moms and their babies 0 to 6 months. This has grown dramatically and unfortunately only goes up to 6 months. So we actually had several moms really kind of freaking out and saying, wait a minute, my kid's going to age out. I really want to come to New Mom's Coffee, which basically led to the creation of Not So New Mom's Coffee, an offering for, again, peer-to-peer facilitated meetings for moms and their babies 7 to 12 months of age. And that led to Toddler Time, which is yet another linear offering to allow moms and family members to come with their kids ages 1 to 3 into a space, the well, that's clean, that's safe, that has really cool, engaging features like the imagination playground setups, and really have a place for families to go. As you can see, there's a variety of other offerings. The sleep class that we offer is now being given nationally and is probably one of our most popular classes, but we also have a variety of other offerings. We have moms, yoga for moms and mom and baby yoga. We have classes at night for moms that are already returning to work. We have also expectant parent classes. Those are free. And as you can see, other classes regarding things like fussy babies and the happy baby classes basically now evolved into a fussy baby clinic for families that have babies that just won't easily calm down. And then again, we have an early childhood developmental specialist that works with things you can't control, like tantrums and potty training and other issues related to toddlers and young kids. Now, this is our New Mom's Coffee group. As I said, it is wildly popular and continues to grow rapidly. As I said, it is now offered virtually, but that's Kathy McGrath, who is known nationally. She's a doula, a childbirth educator, and has a counseling background. And while these are not therapy, these meetings, they are therapeutic. And I will tell you now that across the region, we have a variety of hospitals, health systems, and mental health providers referring moms in to get this really amazing nurturing experience that's non-judgmental, that's safe, that they can come in to really get this peer-to-peer support. Again, many of the moms breastfeed, but not all. Some formula feed. Some choose to do attachment parenting approaches. Some choose to do self-settling approaches, including for sleep. So we have a wide range of opinions, but again, there's really wonderful respect and guidance and support for these moms. And one of the things I can tell you as a pediatrician is I never realized how isolating childbirth can be for moms, but this is an environment that many of these moms have said, no joke, was truly life-saving for them. And we hear this repeatedly. Now, what I will tell you is I mentioned Kids Plus Pediatrics, but we're known for something else nationally because we recognize that it's ludicrous to think that a healthcare provider is going to impart all their wisdom in a 15-minute visit or 10-minute visit, or sometimes longer, within the four walls of the office or clinic. At Kids Plus, we recognize that this communication needs to be inside the clinic, outside the clinic, or outside the four walls of the office. And that's why we believe strongly in a multimodal virtual immersion. And again, we are known nationally for our work in communication. We know our audience and we know how to reach them. And that's because we have a full-time communications director, which is considered quite odd in an independent pediatric practice. But we recognize the value of communication. And in its essence, if you think about healthcare, in its essence, it's about behavior change. If you can't reach people, if you aren't relevant to them, if you can't make a compelling discussion about why they should eat a healthier diet, why they should vaccinate, why they should be compliant with their asthma regimen, then you're really not doing much. As a matter of fact, you'll hear me mention later that I truly believe in 2020, if you are not reaching them in a multimodal way, you're now abandoning your patient to all sorts of misinformation and nefarious sources. So more odd than our full-time communications director is the Kids Plus production studio. We actually have a fully equipped production studio to create videos and podcasts, and we reach people on a multitude of platforms. Our website is known again nationally, and we actually trashed a perfectly good website to recreate this website that had a platform that was dynamic and able to adapt to whatever screen size you were using. It's colorful, it's easy to navigate, the links work, and it's really packed with great information with searchable fields, including the doctor's notes that you see near the top. They're famous, and we have over 300 notes on a variety of topics to allow people to get information at really the click onto our website. Now, as I told you, we're on a variety of social media platforms. And again, this is because this is where our families are. Even when they're in the four walls of our clinic or exam rooms, they're still on social media. Sometimes I actually have to ask families, hey, can you put the phone down while we talk for a bit and do the exam? And I can help answer your questions. But recognize that's an important point, that in the US, we on average use some type of access to the internet for 6+ hours a day. And that's average, some people well over that. And we know that our families are on social media. Why aren't we there? I lecture regularly, both nationally and internationally, imploring health systems, medical schools, nursing schools, public health professionals, that this is where we have to be in 2020 and beyond, or else we're really, again, abandoning our patients and really providing very limited care. It's the truth. It's the reality of 2020 and beyond. So our reach at Kids Plus is not just to the tens of thousands, but into the hundreds of thousands now on a regular basis. We believe if you're not here on people's phones, which is where they primarily now engage the internet or tablet, that you're really not where you need to be. You're not practicing best practices in healthcare. Now, We have a mantra that our communication director has kind of led us down the path to say, which is people, when they access Kids Plus, don't necessarily know what we're going to be talking to them about that day, but they know they're going to like it, whether it's our podcast or our Facebook Lives or our Instagram feeds. They know that they're going to like it. And not only do they know they're going to like it, but they now come to us to vet their own questions. So rather than reading misinformation and believing it, they'll actually come to us and say, hey, what do you think of this article? Is this accurate? Do you guys have better information you can give me? That we are so honored to be able to play this role for families. And if you didn't know it, healthcare providers are still one of the most trusted professions nationally. At the very top actually are nurses, and doctors are a little further down though. If you subdivide doctors, pediatricians actually pretty close to being up there with nurses. Further down on that list are Sith Lords, and below that are Congress people. They certainly don't trust large institutions now either, such as the CDC and NIH, sadly. Those places have a lot of rebuilding of trusted relationships. And yet we squander that resource every day. We don't help our families answer questions, and again, allow them to be just saturated with misinformation. That is no longer tolerable nor acceptable in 2020. And Kids Plus is leading the charge in providing good information and helping bust myths and inoculate people with accurate information before they even get disinformation thrown at them. We have been covered multiple times in the national media and regional media and local media for a variety of reasons. Again, first and foremost, we've been on the cover of the LA Times and the cover of the New York Times Science Times for our work that we've done in addressing anti-vaccine rhetoric, disinformation campaigns, and weaponized social media. We did so much work in this area that we actually launched a nonprofit this year called Shots Heard Around the World, which actually helps to support and promote vaccines while empowering and galvanizing vaccine advocates. But additional work that we've done was appear on Ari Melber's show on MSNBC, advocating for chip reauthorization, and a variety of other issues such as patient engagement and social determinants of health. Kids Plus is focused on building community connections. Now, this might seem odd, but we actually do a regular series called The Game of the Month with a game store in Squirrel Hill called Games Unlimited. Why would a pediatric practice go there? Because we think that toys and games, and they're really primarily just games, are a really important part of socialization and good development. They don't require batteries or links to the internet. They provide amazing family time and bonds to be built, as well as confidence, and kids learn through play. Matter of fact, play is the work of childhood. So they don't pay us anything, we don't pay them anything, but we certainly go and play games there. I oftentimes get beat by the owner there, that's Kylie Primus. That's his first daughter, Sienna. We try and play a game for a variety of ages to highlight to people all the different games that you can play to help with development with your child and how to have family fun, again, without being plugged in front of Netflix or on some video game. The city of Pittsburgh has asked us to provide child and family entertainment. Actually, when they blew the Greenfield Bridge up, which is right next to our office, and when they rebuilt it, they came to Kids Plus to provide that child and family entertainment for the community because they had trust in us and knew how well we engaged the community and how trusted we are. We also provide what we call family fairs, and each spring we provide, again, a way of engaging the community with the imagination playground and fire trucks and bouncy houses, and again, make these family fairs open to the community, free. They don't have to be Kids Plus families to come in. And each December, we have Saturdays with Santa. And again, rather than waiting in a mall, paying money for your picture with Santa, we ask that you bring your own phone. You can hang out for hours. As you can see, there's the imagination playground set up in the bottom right. And families actually do spend hours there, particularly the moms that know each other and families that know each other through New Mom's Coffee, and spend 2 hours, the full 2-hour time there while the kids play. And for the kids that are scared of Santa, it gives them a chance to warm up. On one of the other things I always tell families, that this is a secret, is Santa doesn't smell like beer and he knows how to hold a kid because he's actually a pediatrician. And there's me on the bottom left holding 5 babies from New Mom's Coffee. I will say even I was getting a little nervous. A kid was squirming or getting ready to slip there, but no child was harmed in the making of that picture. We also believe that great healthcare demands great business. And I told you we are business focused. It's one of the reasons we attribute to us remaining independent, because if you didn't know, currently in the United States, 80% of practices are employed. That means they're owned, or the workers there are employed because they're owned. And in Allegheny County, 90% of practices are owned. So we are part of the 10% of independent practices that focus on great business. Looks like this. We won the Ernst & Young Entrepreneur of the Year in 2016 and went on to defend the regional title at the national level down in Palm Springs, where we had our behinds handed to us by a company that was making $1.5 billion in sales. We have a great video that talks about this journey that's about 3 minutes long. We're always happy to share it with you, but it does talk about some of the special things we do here, particularly regarding innovation, communication, and community and patient engagement. We also work with the Carnegie Mellon University's Heinz College, doing systems projects each year. And these are absolutely focused on not just providing the students with an exercise to do, but a real world scenario where we have them help us with real world problems. And these continue each year. We're thrilled to do them. We just had a lovely project that we finished up. We do them each fall. And this has also led to us now embarking on our own continuous quality improvement culture that we have now rolled out recently after doing some training with Atrium Health out of North Carolina, and taking really Toyota method, Lean Six Sigma, and some of the really strong business approaches to looking at variance and really improving quality in a continuous fashion. So that is ongoing now at Kids Plus. We've been voted a top workplace by the Pittsburgh Post-Gazette top workplaces 8 of the last 9 years. And finally, I talk about the importance, of course, of compassion, but also of collaboration. This is just some of the advocacy that we do at Kids Plus. As I pointed out, much of it has been covered by local and regional and national media, but a lot of it hasn't. And that's okay, because we don't do it for the coverage. We do it because these things need to be done to help families. As we know, social determinants of health provide real challenges for families and actually drive a lot of the healthcare costs. And while Kids Plus can't address all the things that governmental agencies need to do, as well as some of the social safety net that isn't always there for these families, we try and fill a really important gap. So as you can see, we do so with healthcare access and coverage. Again, immunizations, the diapers and feminine hygiene products, which are not covered by insurance or SNAP or food stamps. So that's why we collect and distribute it to our families. Working hard on integrative care models. So working with mobile dentistry in our offices. That's a collaborative project we've done with UPMC. Handing out books to families through the Allegheny County library system and through United Way through a program they had as well. And you can see a lot of the work that we do here. It's absolutely important to know that families are in need and are not having their needs met. And with this pandemic, we'll be facing even greater needs. Pediatric practices have a role to play that nobody else can play, because we are the recipients of this huge asset, which are these longitudinal trusted relationships. And we need to help meet families' needs rather than just rushing them in and out and providing sick and well care. So when I think of who we can potentially collaborate with, the answer is pretty much anybody and everybody. And everybody listed here are groups that we do currently collaborate with. And we do so in a really powerful way. We've presented to legislators. We've made pro bono videos for nonprofits in the region. We work with the philanthropic community here in Pittsburgh. We are a for-profit entity, so while we can't receive support from them, we can still work with a variety of the groups, whether it's Grable, Jefferson Regional Foundation, of course, the Jewish Health Foundation. So we work with a variety of groups, preschools, policymakers, researchers. We do active research right now with the Graduate School of Public Health through the University of Pittsburgh, mostly right now on disinformation and social media communications for healthcare providers. So we think that this is a limitless opportunity to collaborate, and we think it's part of what makes Kids Plus so very strong. So as opposed to a place for just sick care and well care, where we think we make the greatest difference, is that Kids Plus is a destination. It's not just a destination physically, and you can see people actually do have birthday parties here. We have fairs. That third picture is almost like a Guinness Book of World Records, where we had how many mother-baby dyads can you have in the same room at one time? The answer was there's over 200 people in that room. I think we had 83 mother-baby dyads. That was going on worldwide simultaneously that day. And again, you can come to see Santa. But just as importantly, people can come to Kids Plus 24/7 on a variety of social media platforms. And first and foremost, our website. We have a portal that's becoming more and more robust and allowing families to engage us the way they want to be engaged. Because in 2020, a strong physical presence is very important, but I think it pales in comparison to what their experience is like virtually. That's where they have to have their needs met. Actually in both places, but of course virtually for sure. So with that, I think we've come in right around 40 some minutes. I know we wanted to leave some time open for Q&A, and I thank you very much.
Great. Thank you so much, Dr. Wolynn. And if you're able to turn on your video on the camera that you are at, you're certainly welcome to do so at this time. We do have a couple of questions that have come in via chat, but I just wanted to comment first on how exciting it was to hear about so many different ways that Kids Plus engages the community and really thinks about healthcare differently than other practices do, I think. I think that so often people think of entrepreneurship as something that comes in and disrupts healthcare, something that people outside of the healthcare space come in and do to healthcare. So it was really exciting to hear about how Kids Plus embraces the idea of being entrepreneurs yourselves and being entrepreneurs as healthcare providers. So I think that that was really a cool philosophy to embrace and something that I hope provides some inspiration to others in the region as well. And also, of course, hearing about kind of thinking about healthcare through a number of different lenses, not just physical care, but of course, the social determinants I know you mentioned a number of times being so important, recognizing that policy plays a really important role in healthcare as well. So the first question that we received actually is related to that policy side of things. And we have a question from Anonymous that says, you're doing such great work. Do you have any initiatives planned to address maternal mortality among Black women in the postpartum phase? So I think a little bit more on the policy side, but would love to hear your thoughts on that question.
Yeah, Pittsburgh actually doesn't have a great record in terms of infant mortality. And when you look at health disparities and the difference in life expectancy from someone in a minority group like the African American group versus Caucasians, it's a huge disparity, and it's driven again by social determinants of health. Now, one of the things that we are working on included within social determinants of health is race and equity. And so it's obviously a bigger lift than a single practice can do, but what it requires again is awareness. And one of the things that we can do with our media presence is to really push out the message of these inequities. So it's definitely a topic that we have slated for our podcast. It is a topic that we have addressed internally with our employees and our families, and making sure that we do everything we can in terms of equity to provide what families need for their kids to thrive, and as well as for the families to thrive. So part of one of the positions we have that's a novel position, and we have several within Kids Plus, is our resource counseling coordinator. So she's an LCSW. Her name is Tierney Ludwig, and she works to make certain that we match families up with the resources that they need. So when we see somebody coming in, besides screening them for food insecurity, we do a variety of screenings, including infant mental health and just general needs. If a family is in need in terms of transportation or housing, We have a plethora of resources to work and make sure we provide a warm handoff, not just a list of, oh, here's a website and go check it. That's not enough in 2020. These families face serious barriers. Think about even just getting on Medicaid or some types of subsidized insurance. Sometimes they require resources like a copying machine and a fax. And so we have, again, a social worker who will work hand in hand with them, providing them the resources and taking them down the path they need to get the resources that they need. So race and equity and infant mortality are all issues that need to be addressed at a much bigger level than Kids Plus, but Kids Plus plans to do its part in making the awareness greater and helping our families on the individual level.
Great, thank you. We've had another question come in through chat, so keep them coming. Love seeing the engagement in the chat here. Pauline asks, how do you incorporate quality improvement in your work? For example, do you examine data? And then how do you engage staff and providers in the projects?
Yep. Again, great question. So this is I will say again, measured on quality metrics that are currently out there, those that are used for HEDIS criteria. We already know using the clinically integrated network that we're in, that we score at the very top level, again, for quality and lowest cost, which are obviously, as you combine them and look for things like even the quadruple aim, we think we're doing a pretty good job, but we don't think that those metrics are the only metrics to be measured against. So we now are really working hard on measuring ourselves against our best efforts and best results, because we think we can continually get better. Part of that is by using data, because you can't really make the necessary change or even validate your change for good without measuring your own data, which is part of the reason why we embarked on this continuous quality improvement. So we have a team, we have a quality team that works on HEDIS measures, and now we have a continuous quality improvement team that is actually really working on creating run charts and PDSA cycles so we can measure variance and we can see what's just part of typical expected day-to-day changes and what are real outliers, whether good or bad, to allow us to say, this is what we need to get better. So we're early into this pathway. We know it's a long path, and by the consulting that we received, they usually say it's oftentimes up to a couple-year rollout to really achieve true making the necessary groundwork there, and can be a path of as long as 5 years to really create the culture and the practice moving forward. We are all in on it. And so, as I said, we just completed the initial consulting, have a team in place, and are now working on creating some of those PDSA cycles and run charts. So yes, we will be using data. And we've already done that with the 10 years of CMU projects with some external student consulting, which was quite beneficial.
Thank you. I actually have a question.
Yeah.
So a lot of your presentation focused on this idea of building connections, which I think is also extremely important in healthcare, this idea of building trust and even helping people form relationships with one another, not only the patient-provider relationship, but also the idea of forming a community with new moms, for example, through the New Moms Coffee. So the idea of connections, I think, was a continuous theme throughout your presentation. And I know you've also mentioned even before the COVID pandemic, Kids Plus has focused on both virtual connections and in-person connections. So I'd love to hear a little bit more from you about what's been challenging about switching some of the things formerly in person to virtual. Do you think that there are some forms of connections that are always going to be better in person, especially in the healthcare space? And what have some of those lessons learned really been about moving more to the virtual side of things these past several months?
Yeah, and thanks, Megan, for pointing out the emphasis I try and put on connectedness and community engagement, because we really do think at its core, it's what is central to Kids Plus. If we aren't trusted and we aren't having a positive impact on families, again, I think it's a real waste of what we know is already, through survey data nationally, a trusted relationship. So why not build upon that? Why not fortify that relationship? So when people come to Kids Plus and they see a well, what the heck is this big well? I mean, this must be like, 1,500 square feet. Why don't you turn it into exam rooms? And we're like, because it's really one of the most powerful things we have is a safe, non-judgmental space for families to come to learn from one another. So it is powerful to have that space. But as you said, during this pandemic, we are unable to bring people into large spaces for gatherings. So to answer your question, we have found that shifting to virtual spaces was actually quite easy for us. Part of the reason for that is, again, we had a communications director that really makes certain that we are communicating at incredibly high levels, and he demands excellence of everything we do, which is why every communication, whether internal or external, really has his blessing and his involvement. So we're on a variety of platforms and have made the transition pretty easily to Zoom and Teams, sometimes Google Hangouts, but whether it's meetings, conferences, lectures, or the new Mums Coffee has moved in its entirety to Zoom. Those mums now not only expect to have weekly engagements for their new Mums Coffee and not so new Mums Coffee, but we've even woven in some other community experts that talk about infant mental health. So TICE, Therapeutic Early Intervention Services, is a great company that's tagged along and is there to talk to moms about things like developmental issues, occupational therapy, or physical therapy. We've teamed up with a group called Girlology, a national group that focuses on puberty and sexuality classes, which we're now offering those almost once a month. Our sleep class, which used to sell out all the time in the well, is now almost once a month. We're taking December off, but starting January, we'll be offering that class. That class is targeted for families with kids pretty much 6 months up to about 2.5 years of age, to teach them how to help their child learn the confidence in transitioning from wakefulness to sleep on their own. And people oftentimes don't recognize how important that is. And there's different parenting philosophies. But if you think about it, and I'm trained in sleep medicine, I ran the sleep lab over at Mercy Hospital for the pediatric program for 9 years. We spend a third of our life in sleep. And if we don't learn good confidence in transitioning from wakefulness to sleep, it actually can be a detriment to our health. We know that insufficient sleep can lead to a variety of factors, whether it's heart disease, blood pressure, increased error, increased pain. And so, believe it or not, we know it's important to teach good sleep hygiene and good sleep habits. And we can do that through some parenting coaching, because you're going to spend a third of your life in sleep. And yet pediatricians aren't trained. We don't learn this in medical school or residency, but yet we knew it was important enough to do because it was a critical part of a child's life. Matter of fact, if you're an adult with lousy sleep, I guarantee you were a lousy kid sleeper for the most part, unless you have some new acquired disease like obstructive sleep apnea. But think about it. If you're a restless sleeper, I'm not a sound sleeper, you have lousy sleep, sleep's really not a good part of your life. But imagine if you can give your kid good sleep. It's very analogous to what we do with breastfeeding. Breastfeeding is physiologically normal. We know that moms that breastfeed have, for the longer you breastfeed, the better these benefits, but moms have decreased ovarian cancer and breast cancer and better bone density. It has more positive impacts on mood. For babies that are breastfed, the longer they're breastfed, decreased leukemia, lymphoma, decreased obesity, decreased diabetes, decreased infections and allergies. Knowing all these things, why isn't that part and parcel of general pediatrics? That's why Kids Plus, every provider is being trained on breastfeeding, and most of us become lactation consultants. And I don't mean to go on and on, but these are areas that in pediatrics are oftentimes just not covered. We know that even in toxic environments where there's the term toxic stress, that when kids are in these environments, unsafe neighborhoods, marital discord in the family, and there's a range, there's called adverse childhood experiences, ACEs, can set a child on a different pathway that can be the difference between literate, employed, and fulfilled to illiterate and incarcerated, right? So the preschool to prison pipeline is a great example. It's one of the reasons we work so closely with childcare, and I am the board president of Trying Together. For that very reason that I said, there's a place for pediatrics and early educators in childcare to get closer together. And that's what led us to become much more closely aligned. We started through the Playful Pittsburgh Collaborative, but then went on to work very closely. And like I said, now board president of Trying Together. So I know that was a long-winded answer, but I wanted to point out Kids Plus tries to find what are the most crucial areas the kids' needs aren't being met and families' needs aren't being met. And that's why we put so many resources into creating them.
No, that's great. Thank you so much for elaborating. We have just 5 minutes left, so I think this will probably be our last question. This
Okay.
comes from Jennifer in the chat. Jennifer says QI is often a challenge for staff quality improvement to view as part of their work and not just as a project. How do you onboard new staff members to your quality improvement approach and culture? And then how do you share this work with your families? And do you have a patient engagement committee?
Yeah, we actually have a parent board. So our parenting board we've been running now for each office has their own parenting board, and we've been running it for a couple of years to get direct, unrestrained feedback from our families. As far as the quality and what we do at Kids Plus, I will put front and center our communication. Check out our website and check out our communications, because I will put, dollars to donuts. The way we communicate is far above and beyond the typical healthcare practice or even health system. And again, that's driven by a communications director who is not just excellent himself, but demands excellence of the communications we put out. So in terms of quality and services, we make sure we communicate the heck out of that. But back to the core question was, how do we really onboard people into this culture of continuous QI? Well, I will tell you, it's still new in terms of this formal launch of creating this as part of the Kids Plus culture, which is a very positive culture, but one that we know everybody has a voice in it. It's not top down, right? Only, of course, we have top down communication and planning, but we need to get everybody involved. And that's part of the benefit of things like Toyota Method. But the other thing is, at its core, there has to be something in it for them. If we do things that create more work for people, then we're not practicing good QI. Continuous quality improvement is about making things better for everybody, for the staff, as well as for the families we serve. And so if we are making more work for people, there's clearly something we're not doing right. And again, we're in our infancy in rolling this out as a key part of the culture, though we've always been good at quality, but really taking a meaningful deep dive into continuous quality improvement is something that we're excited to do. We recognize some of the boundaries that we need to work within, as far as really always making sure that the staff have a voice into it, that we don't just try and create the perfect plan from some committee of directors and owners. That's not the way QI works. You need to see how things are going through the eyes of the people that do that work, and then learn as a group and make things better. And so revisit us in a year and I'll give you a deeper answer to that one.
Great. Thank you so much, Dr. Wolynn. Well, on that note, on behalf of the Liftoff PGH team, I'd like to sincerely thank Kids Plus Pediatrics, Dr. Wolynn and Chad Herman for joining us today on this really fun and exciting virtual tour of Kids Plus Pediatrics, an opportunity to learn a little bit more about your work. I'd also like to let everybody in the audience know that we have a really jam-packed day here at Liftoff PGH. So pretty much immediately following this at 12:15, we are having a lunch pad session. It'll be a conversation led by Nadili Nunez, who is the executive director of Ascender here in Pittsburgh. She will be leading a conversation on entrepreneurship trends, how they're changing, and how Pittsburgh can respond. And then at 1 p.m., we have a session by two Pitt professors who will be talking about cultural competency and how we can integrate lessons on cultural competency in healthcare education for our providers. So thank you again to Kids Plus and to everybody for joining our session today. I hope everybody has a great day. Thank you.
Thank you.